in the governor's budget, the information I have was that the rural health under health innovation was cut from 20 million to 9 million, which is more than 50%. So my question, Dr. Levine, I'm sure you can answer this, is that money, do you know, is that going to the Rural Health Initiative? And could you expound a little bit on the funding for the Rural Health Initiative and the benefits that that will bring to rural Pennsylvania and rural health care? Thank you.
The primary funding for the Pennsylvania Rural Health Model comes from a partnership with CMMI, the Centers for Medicare and Medicaid Services. So they, in total, made up to $25 million available to the state over the course of many years. So the bulk of that funding was up front, and so the appropriation appropriation was open to bring those dollars in. The money is right now used by the department to support the in-house employees and workers who work alongside the hospitals. It also pays for some of the methodology work and to get those global budgets put in place. As this transitions out of the department and goes to the Rural Health Redesign Center, our goal is to transition that relationship that CMMI has with the Department of Health to that independent authority to administer any of the funding that might continue to come from CMMI. But really the benefit of having that authority, that outside group, will allow it to also contract with other states who might want to execute a model similar to this, and then also receive private foundation dollars to support the effort.
So I just wanted to thank you. I couldn't quite hear what you were saying. But the Rural Health Redesign Center is in progress of being set up. There are several different legislative members that will be added to the board, but it'll be up and running, shovel ready, so to speak. But May 26th, we'll have our first official board meeting, although we'll have some ex officio board meetings even beforehand. And the funding, as Sarah was saying, will be continued to have some money from CMMI, but eventually the Rural Health Redesign Center will be self-funded, looking for foundation grants and other types of grants, as well as consulting fees from working with other states.